Hi everyone, welcome to PharmaGrid. In this video, I am going to discuss some patient case study based or clinical oriented type of questions. If you find my channel useful, please like, share and support. So let's begin with today's first question. A 24-year-old woman complains of irritability, restlessness and trouble sleeping. She says that she worries about everything. The physician prescribes diazepam to help calm her anxiety. Diazepam must cross the blood-brain barrier to be effective. Which of the following characteristics would help a drug molecule cross this barrier? Options are hydrophilicity, large size, lipid solubility, weak acid with pKa of 4, weak base with pKa of 9. So in this question, the physician prescribed diazepam, which is a long-acting benzodiazepine. In order to become effective, the diazepam must cross the blood-brain barrier. So in this question, they have asked us to find out the characteristic that help a drug molecule to cross the blood-brain barrier. Here, the correct answer is option C, that is lipid solubility. We know the blood-brain barrier is made up of many layers of cell membrane from multiple cell types. The common physical characteristic of these many membranes is their high lipid content. So this is one of the important feature of this blood-brain barrier. This is made up of lipid soluble compounds or high lipid content. It has got high lipid content. So this means that small size and lipophilicity are drug characteristics favorable for diffusion across the barrier. So in order for a drug molecule to cross the blood-brain barrier, it must be have of small size as well as highly lipid soluble. Hydrophilicity, large size and positive and negative charges all decrease the ability of a molecule to cross the blood-brain barrier. Ionized molecules have greater difficulty crossing the blood-brain barrier than non-ionized molecules. Moving on to the next question. A 38-year-old woman presents to the ophthalmologist for a routine eye examination. She is given intraocular pilocarpine. She was supposed to be administered 2 drops in each to dilate the eyes for the examination. Unfortunately, the eye drops were administered by a new technician who inadvertently administered 10 drops of pilocarpine in each eye. Which of the following agents should be immediately given to the patient? Okay, so in this question, it is a case of overdose. Okay, instead of 2 drops, the patient has been given 10 drops of pilocarpine in each eye. So, which of the following agents should be immediately given to reverse the action of pilocarpine? The options are atropine, carbachol, donepezil, galantamine, rivastigmine. Here the correct answer is option A, that is atropine. Pilocarpine is applied topically to the eyes and produces rapid miosis and contraction of the ciliary muscle. Miosis means constriction of the pupils. Okay, so pilocarpine when applied topically, it will produce rapid miosis and contraction of the ciliary muscle. This patient received too much medication. That is, instead of 2 drops, the patient has received 10 drops. Okay, that is a case of overdose. So atropine, an ocular muscarinic blocker, should be administered immediately in order to reverse the effects of pilocarpine. That's why atropine came as the answer. So now let's see why the remaining options are wrong. Carbachol is an anticholinergic agent that works on the cardiovascular and the gastrointestinal systems. Donepezil is an anticholinergic agent that may have promise in the treatment of Alzheimer's disease. Galantamine is an anticholinergic agent being studied for the treatment of Alzheimer's disease. Rivastigmine is also an anticholinergic agent. It has been shown to delay progression of Alzheimer's disease. That means this donepezil, galantamine and rivastigmine are mainly used for the treatment of Alzheimer's disease. Okay, so hence the answer came as atropine, which is an ocular muscarinic blocker that should be administered immediately in order to reverse the effects of pilocarpine. Next question. A 58-year-old woman with a history of myasthenia gravis presents to the emergency department complaining of generalized abdominal pain. Her current medications include nifedipine and neostigmine. Her caretaker reports that her bottle of neostigmine is empty but was full earlier in the day. Which of the following findings is likely in this patient? Options are bronchodilation, constipation, dizziness, hypotension, xerostomia. So this is a case of myasthenia gravis patient. So myasthenia gravis is a relatively rare acquired autoimmune disorder caused by an antibody-mediated blockade of neuromuscular transmission resulting in skeletal muscle weakness and rapid muscle fatigue. The autoimmune attack occurs when autoantibodies form against the nicotinic acetylcholine postsynaptic receptors at the neuromuscular junction of skeletal muscles. And here, these patients' current medications include nifedipine, which is a dihydropyridine calcium channel blocker, and neostigmine. Neostigmine is a cholinesterase inhibitor. So here the correct answer is option D, that is hypotension. This is because this patient is currently taking neostigmine for the treatment of myasthenia gravis. She has apparently overdosed on this medication. Okay, so this is clear from the question. Okay, the caretaker reports that the bottle of neostigmine is empty but was full earlier in the day. So this is a case of overdose of neostigmine. So the adverse effects can include salivation, flushing, hypotension. Okay, hypotension is in our option. So hence hypotension came as the answer. Other adverse effects include nausea, abdominal pain, diarrhea and bronchospasm. Next question. A 79-year-old man with Alzheimer's disease is found to have significant elevation of liver function tests on routine follow-up examination. Which of the following medication should be maintained at current doses in this patient? Options are donepezil, galantamine, rivastigmine, tacrine, tacrolimus. Okay, so in this question we need to find out the medication which is safe in case of elevated liver enzymes or abnormal liver function test. Correct answer is option C, that is rivastigmine. Rivastigmine is hydrolyzed by acetylcholine esterase to a carbamylate metabolite and has no interaction with drugs that alter the activity of cytochrome P450 dependent enzymes. Thus, rivastigmine can be maintained at routine doses in patients with elevated liver function tests. But see the other options. Donepezil should be dose adjusted in this patient with hepatic insufficiency. Next option is galantamine. It is a substrate for cytochrome P450 and needs to be dose adjusted in this patient. Tacrine has been replaced by other anticholine esterases because of its significant hepatotoxicity. Tacrolimus is used in the renal transplant patient. Hence, here the medication that is suitable for this particular patient is rivastigmine, that is option C. Moving on to the next question. A 71-year-old man will undergo a prostate needle biopsy under anesthesia because of his low pain tolerance and high level of anxiety. The procedure is estimated to take approximately 10 minutes to complete. Which of the following is the most appropriate anesthetic agent for the patient to receive? Options are doxycurium, mivacurium, pancuronium, rocuronium, tubocurarine. Correct answer is option B, that is mivacurium. Mivacurium has a rapid onset of action of about 2 minutes and requires a maximum of 16 minutes for patients to recover. Okay, thus this mivacurium is a very good agent to use for short surgical procedures such as prostate needle biopsy, which takes about 10 minutes to perform. Now see the remaining options. Doxycurium has a slow onset of action, about 6 minutes, and requires nearly 90 minutes for patients to recover. Then pancuronium. It also has rapid onset of action, about 3 minutes, and requires nearly 90 minutes for patients to recover. Rocuronium has a very rapid onset of action, that is about 1 minute, but it requires 45 minutes for patients to recover. Then tubocurarine also has rapid onset of action, about 2 minutes, and the problem is that it requires approximately 40 minutes for patients to recover. Hence, the anesthetic agent suitable for this particular patient is mivacurium because of its rapid onset of action, and also it requires only a maximum of 16 minutes for the patients to recover. So with this question, we have completed today's question discussion series. Thank you everyone. Please like, share and subscribe. Have a nice day.